Join us on this journey as we travel through the history of medicine. The first stop, surgical procedures during the Civil War. During the Civil War, facial reconstruction was one of the procedures performed. Carlton Bergen was the first person to receive this treatment. This helped over 30 people regain their looks from their teeth to their bone structure. Today, facial reconstruction is known as revolutionary. The anesthesia inhaler was also another great component used during this time. It allowed doctors to conduct surgery without the patient feeling little or no pain. It was created by soaking a cloth in chloroform and covering it over the patient's nose. Because the availability was so scarce, they had to create a new way to administer the medicine to the patients. Therefore, they came up with the idea to drop the chloroform in a tube once mixed with oxygen and knock the patient out and allow them to perform the surgery. This new invention reduced the amount of chloroform used from 2 ounces to 1/8 of an ounce. Another one is amputations. During the Civil War, surgeons came to the conclusion that the best way to save lives or to save the limbs, it was to cut them off. Stop. Medicinal procedures during the Civil War. While the anesthesia inhaler was considered a surgical procedure, it was also considered a medicinal procedure because of the use of chloroform. Collodion was another medicine that helped during the Civil War. It was used for closing chest wounds by creating an airtight seal. Third stop, African American volunteers in the yellow fever epidemic of 1793 in Philadelphia. Because of the 1742 yellow fever epidemic in Charleston, South Carolina, Dr. John Lennox observed that African slaves appeared to be affected at rates lower than whites. He thought they had natural immunity. The Free African Society, because they assumed that the Native Africans would have the same immunity to disease as they did malaria, Dr. Rush solicited them to offer their services. Black nurses helped the sick, and black men were hired to carry the corpses. Eventually, Rush realized that his theory was wrong. African Americans were not immune to the fever. He realized that if they were, they probably contracted the immunity before coming to America. Fourth stop, the Tuskegee experiment. White scientists conducted a completely unscientific, non-therapeutic experiment using African Americans as subjects. They injected African Americans with syphilis because they were convinced that syphilis acted differently in blacks compared to whites and wanted to prove it. African Americans were, however, not told that they had syphilis, just that they had bad blood. They withheld the treatment from them for years. Even when they had made the discovery of the common cure antibiotic, penicillin, this action of withholding treatment were permitted/allowed by the U.S. government. Last stop, the immortal cells of Henrietta Lacks. HeLa cells are immortal cells. They were given the name HeLa after the first 2 letters of her first name and the first 2 letters of her last name. These cells can live forever and replicate and reproduce the cells of any disease. The first HeLa cells were discovered in a tumor belonging to Henrietta Lacks. Once she died from cervical cancer, scientists obtained the HeLa cells in her body without permission. Once scientists obtained Henrietta's cells, they were sent all over the world. This allowed scientists to find a cure/study many diseases such as measles, mumps, and HIV. They also discovered a new preventable disease, HPV. And that concludes the journey through the history of medicine.